The reason we've put this short film together is to show some of the pathways and the routes through the emergency department for patients presenting for our care.
The emergency department in Medway Foundation Trust is one of the busiest in the southeast. We see an excess of 90,000 patients a year, which equals to about 270 to over 300 a day. And that is the reason why we have created different pathways.
Our two main routes into A&E are primarily ambulance route or self-presenting walk-in patients. Each patient is always assessed by a senior nurse, and we call that navigation. The purpose of navigation is to ensure that the patient goes to the right pathway. Now that could be either they need a trolley because they're quite poorly, or they need further treatment. It could be that they'll go to the waiting room. Again, they might have further assessments such as bloods, blood pressure, ECG, and then another decision is made as to whether they actually need to be seen by an A&E clinician, or perhaps they could go to the GP.
The process of navigation is heavily based on what we call Manchester triage. Manchester triage is a system of flow charts. There's about 32 of them, and it covers pretty much every sort of complaint or injury or anything that you might develop that you might need to see a healthcare professional for. Our senior nurses use those flow charts to categorize patients to immediate attention required, urgent or routine. And the same flow charts are as well used to give them a priority even within their pathways on how quickly they need to be seen.
Emergencies such as road traffic accidents or cardiac problems, major emergencies like that, we're normally alerted by the ambulance crews. They phone us on a special dedicated line so that we know they're coming in. Patients that come into the trolley area, they could be referred to orthopaedics, surgeons, urology, whatever specialty they need, and then they would then be moved through to a different department in the hospital, and we would try and do that as quickly as we can. It is a very busy A&E department, and depending on what traumas, emergencies we get through the doors, that always affects our waiting times. So when Sylvia came in, it was unclear as to why she'd fallen. Had she tripped? Had she had a faint? We weren't actually quite clear about that, which is why the nurse in charge asked for a series of tests which included blood pressure, blood sugars and ECGs, just to rule out that there was nothing untoward and that she needed more urgent attention. It was deemed she didn't actually need more urgent attention. It was something that could be taken up with the GP. So she was sent to the GP service.
One of our biggest pathways would be see and treat, which is for people that come in with minor injuries. And another one of the biggest pathways would be the Medway On-Call Centre, or MEDOC. Those patients come in and they will still get assessed in navigation by a senior nurse, and then the decision will be made for the best pathway for them, and we will give the option to those patients to go and see MEDOC. Those patients will perhaps be better off trying to get an appointment with their GPs. That equals to about 20 to 25% of our attendances every day.
Phil came in on his own. He self-presented because he'd hurt his ankle about an hour and a half previous. That was the correct thing to do, and we x-rayed. However, we do get, there are some cases where patients will come in and maybe they've hurt their ankle a month ago, and then we would give them some advice on ensuring that they take analgesia, regular pain relief to keep the pain down. But we can still offer them medical attention, but that would be through Medway On-Call. We would be referring to the same-day treatment centre.
There's a general misconception that if patient arrives by ambulance, they will be seen quicker, when it will be down to the initial assessment that is done by the senior nurse rather than the method of arrival.
So now that you've had the chance to see some of the work that we do in the emergency department, maybe this is the time to think about the sort of things you might come here with. And if you do have an illness or an ailment, maybe you should think twice about where you come for treatment. There are alternatives, and perhaps the emergency department isn't always your first choice.